Hey guys, my name is Liza and today we're going to talk about everything you need to understand about OSCE, which is one of the requirements for you to become a registered nurse here in Australia, especially if you are an international nurse. So if that is something that you're interested in, keep on watching. So today I'm actually making this video because I have a lot of friends who's been asking me about OSCE just because I recently passed my OSCE exam September of 2023, and let's all be honest, the first time I've heard about OSCE, I know nothing about it, and I'm actually hoping that this kind of videos can actually somehow give you information or an overview about OSCE. And because I want to somehow immortalize my OSCE experience, that's why I'm actually making this video. If I can help my friends with this video, maybe I can help you as well. So please, if you find this video helpful or informative, please do share this video to your friends or family, and also don't forget to subscribe and like this video. So OSCE is, of course I have to search it. Okay, OSCE is Objective Structured Clinical Exam. It's one of the requirements under OBA pathway. OBA meaning outcome-based assessment. There are a few ways for you to become a registered nurse here in Australia, but OBA pathway is actually one of them. It's either, I'm not sure, I think there's plenty of options, but here are the options that I'm familiar with. Number one is OBA pathway, which is what I took. It composes of two exams, which is the written exam, which is NCLEX, and the second one is the OSCE, which is the practical exam part. And the other ways for you to become a registered nurse here in Australia is conversion. You have to, I think it's 1 to 2 years of study here. I think there are some universities who are offering that, but I'm not very sure because I didn't took that pathway. The third one is actually you have to retake your nursing, enroll to a 3-year course of nursing. Like after graduation, you're gonna be a newly graduate nurse, so all of your experiences in other countries are not gonna be accredited. That is why I chose the OBA pathway, because let's say for example, if you have 5 years of experience, after OBA pathway, you'll immediately become an RN5. That is why a lot of international nurses are actually taking the OBA pathway. So OSCE is actually a method of assessing clinical competence at the graduate level nurse. So they're assessing you as a newly graduate nurse level. They're actually assessing you with practical skills and your communication skills. Of course, practical is, you know, I'm not familiar with the other countries, but I'm from the Philippines. So in my country, it's very similar with like a return demonstration in college. Maybe you have that experience as well. So that is what OSCE is all about, like a return demonstration to AFRA people, you know. And in communication, they assess you, of course, verbal, non-verbal, and also written documentation. So for the steps, you have to, let's say for example, you're finished already with NCLEX. I'm pretty sure when you're watching this video, you already know about the AFRA page and you've already done the NCLEX, so I'm not gonna tackle anything about that. I'm just gonna say that after you pass your NCLEX, your AFRA page will refresh and update and then show you that you have to pay for the OSCE fee first. That's the first step. So my OSCE fee, I'm not sure if it's gonna change 2024, but I think it's been $4,000 for the past few years, 4,000 Australian dollars. And after you pay for the $4,000, that's the only time you're going to progress to the next step, which is joining the queue. Yes, there is actually a queue. During my time, they only held the exams at the University of Adelaide, and they're going to start conducting the exams in Melbourne as well. So starting 2024, there will be 2 test centers for OSCE, and maybe the queue will be faster this time, I'm not sure. But during my time, since there's only 1 test center, which is in the Adelaide, I paid my OSCE exam first week of May. I was only able to get a slot for September OSCE exam. May, June, July, August, and then September. Like I waited for like 5 months, almost 5 months for my exam, you know, to take place. But I'm not sure today because there's gonna be 2 test centers, so maybe candidates will be waiting a little bit less compared to the previous candidates. But still, you have to pay for the $4,000 first in order for you to start the process of OSCE. No need to prepare first. You have to pay first, and then while waiting for your schedule, that's when you actually prepare for the OSCE. Because like what I said, it's a bit of a long wait. That's what I'm suggesting, but it's still up to you. It's always up to you, but that's just what I did. So after you pay for the $4,000, of course you're gonna receive a confirmation email from AFRA. They're just gonna let you know that the next time they're gonna email you is when you are eligible to sit on the exam. And they're gonna tell you ahead of time. They're going to inform you at least a few months before the actual exam in order for you to actually prepare. That is why, while waiting, it is important for you to already join a review center. I don't recommend doing OSCE by yourself, like a DIY. I don't recommend that, especially if you're an international nurse. In my case, it's a bit different. Of course, the care will be the same, but the process is a bit different here in Australia. So you have to familiarize yourself with especially with the forms. You have to familiarize yourself with their forms. And in order for you to do that is actually enroll in a review center, because they're going to prepare you, you know. They have the materials, they have the equipment and laboratories. You just have to choose the best review center for you. I'm just lucky with my review center because I can practice even though I don't have I can join the classes even though I don't have the exam date yet. That is why choose your review centers properly and wisely, you know. Review centers, to be honest, are not cheap as well. You also have to prepare. I think the range is $2,500 to $3,000. Maybe it's cheaper today, I'm not sure, but during my time that's the range. Okay, and if you're offshore, FYI, I'm an onshore applicant. If you're offshore, I think after paying for the OSCE exam, because that's what my friends did, they paid for the OSCE exam, and then that's when they actually applied for the Australian visa, tourist visa to be exact. And I don't think it's the other way around, because majority of the people I know overseas applied for a 1-year tourist visa. So if you applied for the visa too early without starting your OSCE process, you might not get your desired schedule within the time frame of 1 year. I'm not sure. I cannot speak 100% about that. When their visa was granted, they tried to email it again to AFRA in order for them to, you know, just to inform AFRA that, okay, this is my visa. I think AFRA will actually consider your visa time frame. They're gonna be kind enough to give you a schedule within the time frame that you have. And I think that's what people are doing. I'm not sure. You can actually do some research about that, but that's what I know. Like, they pay for the OSCE first, and then that's when they apply for the visa. Also, OSCE in Australia is being held every 2 to 3 months. So it's not like you can actually choose your date, you know. Of course you can choose a date, but the next exam will be like after 2 to 3 months already. So that's too much of a wait. That's why make sure that you are ready when they've given you, like, okay, are you ready to sit in this, let's say for example, September exam. They're just gonna give you an estimated week, but you cannot actually choose which date of that week you're gonna sit on the exam, okay? Just so you can actually file an early leave if you're working. So that's why they're doing that. If you are not available on the September exam, the next date that they're going to offer you is November. The gap is at least 2 to 3 months, so that's already a long wait. So I suggest, if you started your OSCE exam, be prepared for the dates. If you're already eligible to sit on the exam, sit on the exam. Better take that opportunity, because a lot of people are actually queuing for OSCE, so might as well just take it. But of course, it's a case-to-case basis. If you're really not ready, then don't risk it. So that's what happened to me. After paying first week of May, I got my eligibility letter to sit on the exam, I think June. I think I waited like 2 months, because first week of May and then end of June I got my eligibility email. So that's 2 months of waiting. I'm actually going to email them as well that I am happy to take the September exam. So after that, after a month, that's the time they actually sent their booking confirmation. After a month from the eligibility email, so that's already 3 months of waiting. That is the time that they're going to give you the exact date where you're going to sit on the OSCE exam. From the booking confirmation, I have remaining 2 months before my actual exam. So overall, it's 5 months. I waited 5 months for my exam. Again, I'm not sure today if it's the same, but that's what happened to me. And if you're offshore, that is your cue to actually look for flight tickets already. So during the booking confirmation email, immediately after I got my date, that's the best time for you to actually look for hotels where you're going to stay. Of course, make sure the hotel that you're looking for is actually close to the test center. I'm from Sydney, so I think I did not book immediately. Like, I waited for at least 5 days before booking, and then the closest hotel in University of Adelaide is already sold out. Like, okay, I'm sorry, my voice is like this because I'm a bit under the weather today. Again, that's why I'm telling you right now, after getting the confirmation email, that is the best time for you to actually look for hotels already, and of course flight tickets if you're not from the same area where the test is going to happen. Okay, for the OSCE setup, this is just a disclaimer. We actually signed like a non-disclosure agreement that you cannot discuss anything that happened during your exam. Like the setup, I cannot talk about that because of the non-disclosure agreement. So I can only share with you guys the things that are in the AFRA handbook and the things that are still safe to say. That's all I can say. Don't blame me, don't, you know, I cannot do anything about it. I signed a non-disclosure agreement and that's all I can say. But I'm gonna give you tips and tricks that in order for you to actually ace the exam. So I'm just going to do a share screen in order for me to discuss what is in the AFRA website, okay? This is the OSCE candidate handbook. So we're going to discuss this. It says here that the exam composes of 10 random stations. They actually said here that each candidate will be tested on a series of practical skills. These may include, but are not limited to, physiological observations, vital signs, calculating drug doses, etc. There's the ANTT, there's wound care, hand hygiene, there's disposal of shops, infection control, and yeah, it's not limited to this one. So the most important things about nursing itself, that's what the exams are all about. So to be honest, I think I practiced like 23 to 24 different stations. I'm not sure today how many. I think it's already close to 30. That's why I don't suggest DIYs, because 23 stations, 24 stations are already hard to remember. Of course, you already, I mean, we are international nurses. We already know what to do if it's our country. But since it's Australia, you know, it's 23 new steps for you to remember. So it's a bit, you know, a lot. That is why I do suggest enrolling to a review center. So during the exam, each station you have 2 minutes reading time and 8 minutes performance time. So overall you have 10 minutes each station. Imagine 2 minutes reading time, 8 minutes for actually performing the procedure. To be honest, it's not enough. So you have to actually practice and practice in order for you to be able to finish within the time. At first, especially if it's your first week of practicing, it's a bit hard. Let's say, for example, even though you're competent, you are good at all of the procedures, if you won't finish on time, it might actually affect your score. You know, it is very important for you to actually practice. Some people are actually too cocky and thinking, oh, I've done vital signs before, it's very easy, but finishing within the time is actually the most challenging part of this exam. And like what I said, if you practice and practice, it's gonna be easy along the way. But yeah, at first it's a bit overwhelming, like, oh my gosh, 8 minutes, not enough. I'm telling you, that's the trickiest part of this OSCE exam, is the 8 minutes that you're actually trying to do the procedure itself. So it says here that no need to perform under COVID guidelines. So you don't have to, you know, wear your mask, wear like a PPE or something. You don't need to do that. And you're gonna be either having a simulated patient or an actor, or you'll get a mannequin as a patient. So if you get a mannequin, pretend you're actually talking to a real patient. This is what the exam is all about. Like they want to see you, how you interact with a patient. There are some stations that you can get a second nurse. I'm not sure with other countries, but in my country, there are procedures that doesn't require second nurse signature. But here in Australia, there's a lot of procedures that you need a second nurse for you to be able to do some checks, so you might get that in your station. And of course, definitely there's an assessor in every room. Their role is to observe the candidate. Unless needed, they will not help the examinee or the candidate. But there are some stations that you have to present the findings to your assessor. That's the only time that you're going to interact with them. It says here that the setting, you have a 2 minutes reading time, right? Of course, you're gonna be outside a room, and it's on the page. I'm gonna show you later. There is a screen where you're going to read the scenarios, and then there's gonna be a bell that will tell you, okay, time's up, 2 minutes is up, your 8 minutes is starting, you know? So you have to enter your station, and your scenario will tell you if it's a hospital setting, if it's a general practice like a clinic. It can actually tell you as well if it's an aged care or community setting. So you have to pay attention to your scenario. You're gonna get like a paper in order for you to take some notes, and you can bring that inside. What else I can say? I think that's the only thing I can say about that. Like, you will have a paper, and yeah. This is hard. Oh my gosh, it's so hard. Like, I wanted to share everything, but at the same time it's not allowed, so forgive me. I don't want any complications. So if you're going to ask me what kind of patients are you gonna get, it says here that, of course, it's gonna depend. If the scenario says it's an adult patient, of course you're gonna go inside and it's an adult patient. They're not gonna say in the scenario that you're taking care of a 3-year-old patient and then go inside, there's an 18-year-old patient, and then you're gonna pretend he's 3 years old. That's not the scenario. If it says in the scenario that the patient is pediatric, then you're gonna go inside and you'll see a pediatric patient. That's just an example. Or maybe a mannequin, we don't know. You know, they're not gonna make it too complicated for you. Yeah, there's actually, from the handbook, you can actually see some links. It says here that these are the examples of charts and forms that you may be required to be familiar with. It's already written here. There are medication charts, emergency department observation chart. By the way, observation is the term they use for vital signs here in Australia. Maybe you already know that, but in my country, we use vital signs. We don't say observations. So yeah, if they say observation chart, it means vital signs chart. Yeah, there are already available forms here in the page, but I'm telling you, this is not all. This is not all the forms. That's all I can say. That's why practice and be familiar with more forms. These are rooms with mannequins. So these oh my gosh, there's a time. Okay, so Afra says this is what the room looks like, and you're gonna actually get a dummy patient. There's a TV. Probably that is the preparation area. So if you think your preparation area is a separate room, it's not, according to the Afra website. Afra handbook, says here it's not. And yeah, this is the setting. And okay, that's a mannequin, and look at that bed. Okay, you have to be familiar. I'm pretty sure some of us seen this already. And yeah, that's a mannequin, and then look, there's a blood pressure cuff, and yeah, this is another dummy, and then there's a tray. Pretty much that's it. That's what you will see inside. And then this one is rooms as hospital suites. So okay, what's this? Cardiac monitor. If you need it, it's gonna be there. So if it's a clinic, it says here in the handbook that it will look like this. But just pretend that in every room there is like a corner for the assessor. Pretend they're not there. You know, you have to practice. Your focus is only on the patient, pretending you're the only person in the room even though you're not. And it says here equipment specific to the case. Oh, see, it says here equipment specific to the case, meaning the equipments that they're going to give you are the ones that you actually need depending on your case. Okay, there's hand sanitizers, you know, gloves. Okay, the next picture is BP cuff, stethoscope. That is probably the preparation, what your preparation area will look like. And yeah, at least they have pictures. I mean, there's room for imagination. That's good. So this is what your stations will look like. I don't think they have updated this handbook, but this is still in Adelaide. If you enter the university, you're gonna see this. That's where you will go for registration. Okay, there's candidate terms of agreement. There's also video and audio consent form, because you will be recorded and videotaped during your exam. There's a consent, of course. And this is your candidate ID card. Okay, first name, surname, and then ID section. You're gonna get like an ID number What else? Notepads and notebooks, okay? There's actually candidate waiting room. So if your exam is in the morning, definitely they're gonna make sure you're not gonna be able to see the afternoon candidates. So they're going to hold you probably just a few hours. They're just gonna hold you, and once the second batch enters, that's the only time. Bye, thank you. And then after that, wait for 4 to 8 weeks before the result. 4 to 8 weeks. 4 to 8 weeks. Okay, next is, oh, okay, this is the outside. That's good. You will be assigned of one of these stations, and so if you're sitting here, the second one is sitting there, definitely it's not allowed for you to talk to each other. That's not allowed. And then there is this computer in front of you, or screen in front of you, monitor in front of you, and that is where you're going to read your scenario. And you can see this black over here, that's where you scan your ID in order for the computer to register you. If you're curious, you all start at the same time. So you all finish at the same time. Oh yeah, here is the one where you scan your card, and it says here, log in. Yeah, that's it. I think that's it. Okay, for the dress code, we're still in the handbook, okay? It says here that you have to wear comfortable clothing, and then these are the clothes that are not allowed. You're not allowed to wear jeans, tracksuit pants, ripped. Fingernails should be cut short, and then you cannot wear any top that is below your elbow. It's always above. So even though it's cold, just bring a jacket, but inside it should be like above your elbow, because I think that's within the infection control protocols. Just to summarize this, wear a scrub suit. Everyone is doing it. Wear a scrub suit. That is the safest. But be mindful, you cannot have anything that has your hospitals, I mean previous hospitals that where you worked with, you cannot have them written on your scrubs. It should be like a plain scrub suit. I'm not even sure about the surname, but I haven't seen any person have their scrub suit with their name on it. I'm not sure if it's allowed, but might as well just don't have it. Just buy a new one. Buy from Kmart. It's cheaper in Kmart. That's what I did. I bought my scrub suit in Kmart. Of course, your hair should be tied, and don't make it like a ponytail. Because example, if you're going to do a CPR, oh my gosh, your hair will be, you know, all over your face, and you don't want that. You don't want any distraction during that 8 minutes. 8 minutes is already short enough for you to have distractions. So don't. Just tie them in a bun or buy a hairnet and then cover it, you know? Make yourself comfortable. And then for the shoes, it should be black. Afra actually mentioned it, that it should be black. Some people have their shoes black and then check is white, or if it's an Adidas stripe that is white, I think it's already allowed. Mine is a Skechers one, which is pure black. Sole, logo, shoelaces, all black. Because I really want to be safe. I don't want to risk it, like go there. Adelaide is in another state. I don't want to risk it. I don't want to have a problem that day. So I made sure it's all black. But yes, some people, they have like, there is slight white in the design, but mostly it should be majority black, okay? And all you have to bring is passport. That's it. Food, bringing food is actually not advisable. Yeah, we didn't bring anything. Like, because they're gonna put your things in a satchel, especially your gadgets. Everything you have is just an ID, that's it. So might as well just bring anything that you only need. And no need to bring pens or paper, no need. Just your passport and yourself, girl. That's it. Water is included, just raise your hand. You can only do your breaks during the 2 minutes that you're reading the scenario, especially if it's a toilet break. Oh my goodness, that is why people don't want to drink a lot of water before the exams, because if you will do your toilet break, you're gonna use your 2-minute reading time just to go to the toilet. They're not gonna pause the time for you. But this is what happened to me. I think it's safe to say this. It just so happened that my first station, because of my anxiety, of course, sympathetic nervous system, it's gonna dry up your throat. I'm speaking and speaking, and then suddenly I can feel like my throat is very dry, and I told myself I cannot continue. This is just my first station, because of course I'm anxious and I don't want to drink water first, but I have no choice because I don't want my voice affect my second station. So what I did is I actually asked for water. I took like this. That's enough, just to, you know, moisten my throat. That's it. And then after a few minutes, that's when I started to calm down, and then I didn't need the water again. Thank God I finished my 10th station without even feeling my bladder. You can go to the toilet before you actually start the examination. You can, but yeah, during, I don't recommend it. And arrive at least 30 minutes before time. I don't think you can arrive like more than an hour before because they're not gonna let you in anyway. So might as well just arrive like probably 30 minutes is the safest. Yeah, I do recommend booking hotels very close to the test centers. Probably like a walking distance would be the safest. Be mindful because that's actually my mistake. This is a university, okay, in Adelaide. There is this simulation area and then there's another one. They're not very close because University of Adelaide is very big. I booked it close to this one because I thought this is where my exam will be held. And then to my surprise, my laboratory, my simulation center was on this side. From 7-minute walk from this Tower A, we're gonna call it Tower A, it's supposed to be like a 7-minute walk. So since my exam was held at Tower B, the walking distance became 20 minutes. So of course I have to book a Didi or an Uber in order for me to go there. That's the least thing you want to do. Exhaust yourself before the exam. So yeah. Okay, I think we're finished with the setup.